Did you know that once your blood pressure crosses a certain threshold, your risk of stroke can skyrocket alarmingly? This isn't just a dry number in your medical chart, it's the line between living your normal life and facing a life-altering event that could leave lasting damage. Millions of Americans live with high blood pressure every day, and many don't even realize their numbers have quietly crossed into the danger zone. In this video, we'll break down what blood pressure levels are truly alarming, the key difference between systolic and diastolic pressure, and why even small, persistent increases over time can cause irreversible damage to the brain's blood vessels. Using the latest medical data and expert insights from neurologists, you'll get the clearest picture yet of how high blood pressure and stroke are connected, and more importantly, when to take action to protect yourself. Have you ever wondered why high blood pressure is so dangerous, especially when it doesn't cause any clear pain or warning signs? That's exactly what makes it so deadly. Known as the silent killer, hypertension often has no obvious symptoms until it's too late. Many people don't discover they're in the danger zone until they've already suffered a serious stroke. In the next part of this video, we'll help you understand the link between blood pressure and brain damage, and show you the most effective ways to keep your numbers under control so you can protect your heart, your brain, and your future. But first, what exactly is high blood pressure? In a clinical setting, you're considered hypertensive if your blood pressure consistently reads 140/90 mmHg or higher. If you're checking it at home using a personal monitor, 135/85 mmHg is already a warning sign. And on a 24-hour ambulatory monitor, even an average of 130/80 mmHg is cause for concern. These may seem like small numbers, but they carry huge consequences for your heart, your brain, and your overall health. In the next section, we'll show you how high blood pressure silently injures the blood vessels in your brain, and what you can do starting today to stop it. Does age change what's considered high blood pressure? The answer is no. Whether you're 30 or 70, the threshold for diagnosing high blood pressure remains the same. While some individuals may naturally run a bit higher or lower, any significant deviation from the normal range should always be evaluated, especially if stroke risk factors are present. But why exactly does high blood pressure lead to stroke? When blood pressure rises too high, too fast, it puts intense strain on the blood vessels in your brain. If one of those vessels bursts under pressure, blood spills into the brain tissue. This is called a hemorrhagic stroke. It's a life-threatening event that often causes permanent damage or even death. Even more concerning is the long-term damage from chronically elevated blood pressure, which many people have for years without realizing it. High pressure slowly injures the delicate walls of small arteries. Over time, this leads to atherosclerosis, where the arteries become stiff, narrow, and lose their natural flexibility. The result? Reduced blood flow to the brain. If a blockage completely cuts off circulation to part of the brain, it causes an ischemic stroke, the most common type. Studies show that any reading consistently above 140/90 mmHg significantly increases your stroke risk, and the higher the number, the greater the danger. Two main types of stroke, both connected to high blood pressure. Ischemic stroke, blocked artery, accounts for the majority of strokes, caused by narrowed or clogged vessels, often due to atherosclerosis. Hemorrhagic stroke, ruptured vessel, less common but far more deadly, often triggered by sudden blood pressure spikes, which rupture a weakened vessel in the brain, leading to bleeding inside the brain. Whether slow and silent or fast and dramatic, high blood pressure is the #1 controllable risk factor for stroke. In the next section, we'll walk you through simple, science-backed strategies to bring your numbers down and keep your brain safe for years to come. Why people with high blood pressure are often just one step away from a stroke. One of the most common and dangerous mistakes people make is stopping their blood pressure medication as soon as their numbers seem under control, or adjusting the dosage without consulting a doctor. Some continue taking an old prescription for months or even years without follow-up visits, missing crucial updates to their treatment plan. Even worse, Some turn to unverified home remedies or medications borrowed from friends or family because they heard it works. There's another dangerous myth, especially among younger adults. High blood pressure only affects the elderly. In truth, hypertension is increasingly common in younger people, largely due to sedentary lifestyles, poor diet, and chronic stress. But because of this false sense of security, many don't monitor their blood pressure, ignore early warning signs, and delay seeking professional care until it's too late. The takeaway? Don't let misinformation or overconfidence put your life, or a loved one's, at risk. Managing blood pressure isn't just about taking pills. It's a long-term commitment that includes regular checkups, proper monitoring, and a trusted medical partner. Recognizing stroke symptoms early could be the difference between life and death. Whether it's an ischemic stroke, blocked artery, or hemorrhagic stroke, brain bleed, the early signs often look the same, and catching them fast could mean the difference between survival and lasting disability. Here's a simple, powerful tool to remember. FAST. F. Face. Ask the person to smile. Is one side drooping or uneven? A. Arms. Ask them to raise both arms. Does one drift downward or feel weak? S. Speech. Is their speech slurred, garbled, or hard to understand? T. Time. Time is brain. If you see any of these signs, call 911 immediately. Don't wait. Don't guess. Don't try to handle it at home. Every minute matters. Swift action could save a life and preserve independence. Critical warning for people with a history of high blood pressure. What not to do. During a suspected stroke. If someone with known high blood pressure shows signs of a possible stroke, do not give them blood pressure medication at home. Managing blood pressure during a stroke is not a one-size-fits-all decision. It must depend on the type of stroke. In a hemorrhagic stroke, bleeding in the brain, lowering blood pressure quickly may be necessary to prevent further bleeding. But in an ischemic stroke, blood clot blocking blood flow, reducing blood pressure too early can make things worse, by cutting off the brain's oxygen supply even further. That's why adjusting blood pressure at home in an emergency can be dangerous, or even fatal. The only right move is to get the patient to a stroke-ready medical center as quickly as possible. What's the right way to respond when you suspect a stroke? Here's what you should do. Calmly and immediately, call 911 or emergency services without delay. Lay the person down, ideally on their side, at about a 45-degree angle if possible. This position helps prevent choking if vomiting occurs. Loosen tight clothing around the neck, chest, or waist to ease breathing. Check pulse and breathing. If there's no pulse or breathing, start CPR if you're trained. Note the exact time when symptoms first appeared. This information is vital. It helps doctors determine which treatment, like clot-busting drugs, may still be effective. Bring any current medications or prescriptions to the hospital if available. This can give the emergency team valuable context for safe and effective care. Time is brain. Every minute lost increases the risk of permanent damage. Your calm, informed action could save a life and protect someone's ability to walk, talk, and live independently. Never wait to see if stroke symptoms go away. When it comes to stroke, every minute matters, and every minute lost means brain cells dying. Acting fast can save the life of your loved one, or even your own. You've probably heard the term the golden hour in stroke treatment, but did you know that it works differently depending on the type of stroke? Ischemic stroke. This is the most common type, caused by a blood clot blocking blood flow to the brain. The most critical window for using clot-busting medication, TPA, is within 4.5 hours from the onset of symptoms. In some cases, mechanical thrombectomy, a procedure to physically remove the clot from a large artery, may be performed within up to 6 hours or longer based on clinical evaluation. Hemorrhagic stroke. This type occurs when a blood vessel in the brain ruptures. There's no fixed golden hour, but early intervention is still vital. to stop the bleeding, reduce brain pressure, and save life. Bottom line, regardless of the stroke type, getting the patient to a specialized stroke center ASAP is the best chance for recovery. I take my blood pressure meds regularly, so why did I still have a stroke? This is a question doctors hear often, and the truth is, taking medication consistently lowers your risk, but it doesn't make you immune. Stroke risk is influenced by multiple factors: age, genetics, underlying health conditions like diabetes, kidney disease, high cholesterol, heart failure, how well the medication is working for your specific body, lifestyle habits, medication adherence, not just taking the pills, but taking the right ones, at the right dose, under regular medical supervision. Many older adults, especially those with multiple conditions, may still struggle to control their blood pressure despite being on treatment. Why? As we age, our bodies go through changes, hormone shifts such as decreased renin or aldosterone, reduced ability to eliminate salt, lower responsiveness to certain medications. This means your treatment plan might need regular adjustments, not just a one-size-fits-all prescription renewed year after year. So, how can people with high blood pressure reduce their stroke risk? Effectively, first, manage your blood pressure diligently. Check your BP regularly. Take medications exactly as prescribed. Don't skip doses or make adjustments without your doctors. Second, don't ignore related conditions like diabetes or high cholesterol. These are partners in crime that silently damage your brain's blood vessels and dramatically increase stroke risk. Third, live actively and healthily. Cut back on salt. Eat more fruits and vegetables. Get enough sleep. Exercise moderately. Quit smoking. Limit alcohol. These habits work together to reduce your long-term risk. And finally, avoid common mistakes. Never say, "I feel fine, so I'll stop taking my meds." Never reuse old prescriptions without regular checkups. Follow-up appointments and treatment adjustments are essential to protect your brain and prevent stroke. Remember, controlling high blood pressure isn't a short-term task. It's a long-term strategy for life. Don't let dangerous misunderstandings cost you your health. One of the most common myths is, "I feel healthy, so I don't need to treat my high blood pressure." The truth is, high blood pressure often has no symptoms, yet it silently damages artery walls, making it the #1 cause of stroke. Feeling fine doesn't mean your blood pressure is fine. Another misconception, as long as I take my meds, I don't need to worry about my diet, sleep, or exercise. In reality, medication is just one part of a successful plan. Lifestyle changes are what keep blood pressure stable over the long haul. Even if you feel nothing unusual, routine checkups are crucial. And if you're young and diagnosed with high blood pressure, it's vital to look deeper for underlying causes, such as hormonal imbalances, genetic factors, or undetected health conditions that may require a different treatment plan. So if someone in your family has high blood pressure, how can you be prepared? A home blood pressure monitor. Choose a reliable, easy-to-use model for regular tracking. Medication management. Make sure prescriptions are up to date and taken as directed. Stroke awareness. Everyone in the family should understand the fast warning signs: face drooping, arm weakness, speech difficulty, time to call 911. Basic first aid knowledge. Know what to do while waiting for emergency responders. The first few minutes can make the difference between life and death, or a full recovery versus permanent disability. Approval. In summary, today, you've gained a clearer roadmap, from understanding your blood pressure numbers to spotting early signs of stroke, and most importantly, learning how to take charge of your health and protect the ones you love. High blood pressure may be a silent killer, but with awareness, timely action, and healthy habits, you can take back control and shape a healthier future for yourself. Don't let stroke write your story. You can take the pen. If you found this video helpful, hit that like button and subscribe to our channel so you won't miss more essential heart and brain health tips. And if someone you care about is living with high blood pressure, share this video with them. One timely message could save a life. Most importantly, if you have any concerns about your numbers, don't wait. talk to your doctor or a qualified healthcare provider. They're the ones who can guide you with personalized advice and the right treatment plan. Thank you for watching all the way through. Stay healthy, stay informed, stay proactive. And don't forget to check out our next video, filled with more practical, up-to-date, and easy-to-understand knowledge to help you live well. See you next time, right here on our channel.